Hello, this is Dr. Bindushaw, Genetic Counselor at GeneTech. Today we have with us Dr. Vinata Surabhi, a senior and experienced genetic counselor at GeneTech. Let us talk to her about prenatal genetic diagnostic tests done on pregnant women during pregnancy. Hello ma'am, can you please tell us what these prenatal diagnostic genetic tests are?
Tests that are done in pregnancy are prenatal tests, but genetic diagnostic tests are invasive procedures that are done on the fetal sample which is taken from the womb of the pregnant women during pregnancy, and a genetic evaluation is done on these tests to diagnose the genetic disorder.
Madam, what are these tests and whom do you recommend these tests to?
See, these genetic diagnostic tests are recommended for basically high risk patients. High risk pregnancies. High risk pregnancies, for example, a couple with a previous baby having a genetic condition or a family history of a genetic condition. Such people would like to rule out the same condition in the current pregnancy. In such cases, we recommend these tests. Or, for example, if in the preliminary pregnancy test like a double marker or NIPT, the risk if the result shows high risk, then high risk for Down syndrome, Turner's or Patau or Edwards syndrome. In such cases also these tests are referred.
At what gestational age can patients get these tests done, ma'am?
See, these tests can be done at certain gestational age. For example, amniocentesis, which is a common procedure, is done around the 16th week of gestation, and in this procedure we collect the fluid which is surrounding the fetus, and a test is done by the lab on the fluid. The fluid basically has the cells of the baby which is come from the gastrointestinal tract or is shed from the skin of the fetus. Another procedure which is relatively uncommon is chorionic villi sampling, which is done at a very early gestation, that is around 11th to 13th week, where the uterus, the womb and the baby are connected with some structure called villi, where we collect that villi sample and do a testing on that.
Madam, how are these procedures done at our center and who does these procedures, ma'am?
These are ultrasound guided procedures done by an experienced radiologist under sterile conditions. The whole procedure will take around 10 to 15 minutes. The radiologist will visualize the position of the fetus and the placenta, and based on the position and the placenta will select a water pocket, and on the abdomen is going to give you local anesthesia. The area becomes numb, and then insert a very thin sterile needle and extracts the amniotic fluid. It's an outpatient procedure.
Are there any precautions that need to be taken during or after the procedure, ma'am?
The radiologist basically takes all the precautions during the procedure, and post the procedure we advise the patient to take rest for around half an hour at our center. Then for 24 hours we ask them not to exert themselves, like lifting heavy weights, walking, or probably climbing stairs also. In case there is any leak or any pain, inconvenience that is noted by the patient, we ask them to contact the consulting gynecologist immediately. Also, in patients where their blood group is Rh negative, then an anti-D injection has to be administered within 24 hours.
What percentage of patients develop these complications?
These procedures are relatively safe procedures. Majority of women do not experience any kind of complication. But there is a small risk, like around 0.5% risk of pregnancy loss associated with amniocentesis, and 1% of pregnancy loss with CVS sampling. But it has to be kept in mind that the benefit of taking this test is much more compared to the risk that is being taken.
Are there any guidelines for these procedures, ma'am?
The labs that conduct these tests, that is the ultrasound or the invasive procedures, have to be registered under PNDT Act. Baby's sex is never revealed during or after the procedure. Patients are explained in the genetic counseling session about the procedure, the risks, the benefits and the precautions to be taken. families are actually encouraged to attend these detailed genetic counseling sessions to understand the procedure.
That was really useful information, madam. Thank you.